After receiving your autologous stem cell transplant and your blood cell counts are coming up, your MD Anderson Cancer Center care team will start preparing you to leave the hospital. Most autologous stem cell transplant patients leave the hospital around 2 weeks after receiving their cells. To decide when you may leave, your care team will review the following criteria. Your absolute neutrophil count should be at least 1,000 or higher. Neutrophils are white blood cells that help your body fight off infection. Your temperature must be below 100.4 degrees Fahrenheit or 38 degrees Celsius for at least 72 hours. Temperatures above this may be a sign of an infection. You must be able to drink 8 to 10 glasses or 1.5 to 2 liters of fluids per day, eat small amounts of food, and swallow all of your medicines by mouth without trouble. You must be able to do simple tasks such as dressing, walking, and going to the bathroom, even though you may still feel very weak. Before leaving the hospital, you must have a caregiver and a local place to stay that is within 30 minutes of MD Anderson for about 30 days. Your caregiver must be available 24 hours a day and able to take you to MD Anderson quickly if needed. Your local housing arrangements must be ready for you 24 hours before you leave the hospital. Talk with your social worker if you need help finding housing. Before you go, your advanced practice provider will discuss these patient education sheets with you, autologous stem cell transplant discharge instructions, and foods to choose during and after stem cell transplant. They'll also answer any questions you or your caregiver may have. When you leave the hospital, you'll likely have your central venous catheter, commonly referred to as a CVC, in place until around day 30 after your transplant. The CVC stays in place so the care team can continue to give IV treatments if needed, such as blood or platelet transfusions or fluids. It may also be used to draw blood for lab tests. A CVC requires care every day. This is why you or your caregiver must attend a CVC care class in the Vascular Access and Procedure Center. You'll learn how to care for the CVC, flush the CVC, and demonstrate CVC care to a nurse with the Vascular Access and Procedure Center. Talk with your nurse for information about class time and location. Your medical team will schedule you to have the CVC removed when you no longer need transfusions or IV fluids on a routine basis. You will need certain supplies for home, such as a thermometer for your use only, alcohol-based hand sanitizer, a box of face masks, plastic wrap and adhesive tape to cover your CVC when you shower, and alcohol prep pads. Your caregiver can buy these items at a local grocery, pharmacy, or medical supply store. When you're ready to leave the hospital, the care team will provide you with 1 or 2 face masks. After you demonstrate CVC care and how to flush the CVC successfully to a nurse with the Vascular Access and Procedure Center, you'll receive 1 week of supplies and instructions on how to get more supplies. A nurse with the Vascular Access and Procedure Center will contact your medical team to provide a prescription for saline flushes. If the return demonstration is not completed before you leave, you must do the return demonstration with a nurse at the Vascular Access and Procedure Center as an outpatient, or come to the hospital to have your CVC dressing changed or saline flushing when needed. The night before you are expected to leave the hospital, your night nurse will draw blood for your lab tests around midnight. This is done to make sure the results are ready early and your discharge is not delayed if you need to receive fluids or blood products before you leave. The day before or on the day you are expected to leave, your advanced practice provider will meet with you to review discharge instructions, answer your questions, and schedule your follow-up appointments in the Stem Cell Transplant Fast Track Clinic. Your advanced practice provider or stem cell transplant doctor will evaluate you again before you are discharged. Your clinical pharmacist, commonly referred to as a PharmD, will also meet with you on the day of your discharge to review the medicines you must take after you leave the hospital. Prescriptions can be sent to the MD Anderson pharmacy for your caregiver to pick up, or sent to your preferred outpatient pharmacy for pickup later. It's very important to take all of your medicines as directed. The care team will give you a list of your medicines. Your medicine list may include antivirals to help prevent infection, and antibiotics and antifungals if you are being treated for an active infection. Do not take any medicines that are not on your list without talking with your care team. This includes herbal medicines, supplements, and over-the-counter medicines. The list will also include medicines that you may take only if needed. You will sign discharge forms before you leave, and then patient transport staff will take you and your belongings to the discharge center. As an outpatient, you'll have follow-up visits 2 to 3 times a week in the Stem Cell Fast Track Clinic for 2 weeks, depending on your condition and test results. In general, you'll be monitored for 1 month after your stem cell transplant. When you return to the Fast Track Clinic for your appointment with your advanced practice registered nurse, be sure to arrive at your scheduled time. You'll check in for your clinic visits and lab tests. Your care team will take your vital signs and then direct you to the lab for your tests. Your nurse will see you after your lab results are ready. If needed, you'll receive IV fluids and blood products. At these visits, your nurse will review your lab results, do a physical exam, and ask you about your diet, medicines, and any side effects such as nausea, vomiting, diarrhea, and pain. Be sure to tell your nurse about any new symptoms or symptoms that are getting worse. It's important that you go to MD Anderson's Acute Cancer Care Center right away if you have a fever higher than 100.4 degrees Fahrenheit or 38 degrees Celsius, nausea and vomiting that does not stop or get better with medicine, extreme diarrhea that does not get better with medicine, bleeding from the gums or nose that does not stop, blood in stool or coughing up blood, pain that does not go away or get better, chest pain, cough that does not go away, shortness of breath, feeling lightheaded or dizzy, or a rapid heartbeat. Call 911 if you cannot get to the Acute Cancer Care Center. Talk with your stem cell transplant care team if you have any questions.